Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Many people want to quit smoking to improve their health, save money, and benefit their family and social life, but quitting isn't always easy. I'm talking about that with Jackson Tarr. He's a respiratory therapist at Upstate who serves as the tobacco treatment education coordinator for the Upstate Cancer Center. Welcome to the Informed Patient, Mr. Tarr.
Good morning. Thank you very much for having me.
Cigarette smoking in the United States has been declining, but the use of other tobacco products like e-cigarettes has been increasing. About what percent of people in the U.S. use some form of tobacco?
You're right. The good thing is the traditional smoking has been decreasing, but if you put all tobacco products together, like for instance, cigarettes, cigars, vaping, chewing, that kind of thing, you'll see that 1 in 5 adults typically will use tobacco. So smoking is declining, which is a great thing, but what's changing typically now is how people use it. They're switching to vaping, other forms of harm reduction, and nicotine pouches and those kind of things.
Is vaping more popular with the younger generations?
Absolutely. The typical age pattern with vaping, it started, about 10 plus years ago. So 18 to 25, that's the young adult age group, tends to vape a lot more with some cigarette mixing. They're the age group that tends to dual use. And when it comes to teenagers, they typically steer away from all tobacco use. They think it's disgusting. You've seen their parents, grandparents do it. They just use typically just e-cigarettes.
How does it break down by gender? Do women or men favor smoking more than one or the other?
Traditionally, it's always been men who use tobacco more than women. Earlier in marketing days, way back in the old days, cigarette smoking was marketed towards men. And as we know, men typically have higher risk behaviors. They tend to do those kind of things. And social norms kind of brought it to the forefront and it's more acceptable. But in today's day and age, with the increase of other forms of nicotine, you're seeing a lot more women. The gap is kind of decreasing a little bit.
Do we have studies yet that show whether smoking or vaping e-cigarettes does as much damage as smoking regular cigarettes?
Not yet. Smoking has got lots of 40-year plus old studies that show how dangerous it really is. We know that vaping doesn't so far cause long-term illness compared to smoking, but what we can say is that vaping does cause problems. It causes lung irritation, and we just don't know the true data. It's not available yet, unfortunately. So time will tell.
Do e-cigarettes contain the nicotine and tar and carbon monoxide and the other chemicals that are found in cigarettes?
Vaping is not combustible, so it does not contain tar or carbon monoxide, which is a great thing. Those are the big problems with smoking. But it does contain nicotine and oftentimes higher levels and other chemicals besides that. Glycerin, propylene glycol, the fillers, the flavorings. And when heated, those produce other compounds that can definitely lead to some more harm. So it's a different mix. It's a different way to do nicotine. And it's not just water vapor, which some kids think it is. So it's not harmless, sadly.
But it's vapor. It's not on fire. It's not flammable.
Correct. So how it works, there's a typical chamber with the fluid that's in the vape device, whatever device that is. And there's a wicking device and it wicks down towards the heating element and it heats it up to a certain temperature where it produces this vape, which contains all the other chemicals, including the nicotine. And that's how it's absorbed in the lungs, inhaled.
And then aren't there flavors for the vaping?
Yes, there are probably over 7,000 flavors, and that's why it's so difficult for kids nowadays. Big Tobacco says they don't target young people, but in fact, that's why they have such delicious sounding flavors, bubblegum, fruits, you name it, they've got it. So it makes it difficult for young kids. They think it tastes good, no big deal. And oftentimes they get hooked and they have trouble stopping.
Now, for people who want to quit, what are the top reasons that you hear from people that they want to quit smoking or vaping?
Well, in my experience, I work with the cancer center here, so I get half my referrals from this place here. So a lot of them, they have some form of cancer, right? Health is typically the number one option. They want to breathe better. They want to breathe easier. They want more energy. Oftentimes, family is a big player here. They have kids. They have grandkids. They're always hounding them. They want to stick around. And longevity is very important to them. And as you know, in New York, cigarettes are taxed extremely highly. So price of cigarettes, if you buy brand names, are up to $16, $17 per pack. So that can have a huge impact on someone's finances.
Wow. Well, what is the next step after someone says they want to quit? What do they do to actually have that happen?
The first step is, yeah, getting that motivation to finally do that. That's a huge first step. After that, what you really want to do is start thinking about making a detailed plan, build a plan, and don't just rely on willpower alone. And what this means is looking in the future, looking for a quit date, choosing a quit date. Look for support, call your doctor. There's counseling available. There's a New York State quit line. There's all kinds of resources on the internet. Get medication lined up and start to think about a clear plan, which can make quitting much more successful.
This is Upstate, the Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Tobacco Treatment Education Coordinator Jackson Tarr. So let's talk about how you help a person pick a strategy. I know you said not to rely on willpower alone. Some people want to try the cold turkey. Is that the same thing? Stopping cold turkey?
Yes, cold turkey is just quitting without the use of pharmaceutical medication or counseling. So going on your own, just stop buying cigarettes and try to quit from right there. It works for some people. It's not easy. It's the hardest way to quit. It's the least successful way, but it is possible. It has to be a big motivation. So some people have success with it and many people do not.
Have you seen a gradually cut down strategy work?
Absolutely. Cutting down absolutely works if it's done with a clear plan. Sometimes people just start the cutting back process randomly and it could work. But if you schedule a reduction and you can even use medication while reducing, while tapering, it can really be helpful. And a lot of times you want to think about which cigarettes do you want to give up first, the hard ones or the easy ones, the ones that are on autopilot. Typically, I like to ask my patients, which are you willing to give up at first to help them build some motive or some confidence and kind of help them move in the right direction. Randomly cutting back, it does work, it can work, but structure can make all the difference.
You mentioned medications. Are these nicotine replacement medications or is this something else?
Right now, there are 6 FDA medications approved for tobacco cessation. 4 of them are nicotine replacement. 3 of them are over the counter. The over the counter medications are the nicotine patches. There are nicotine lozenges and nicotine gum. 3 of them are prescription only. One's a nicotine replacement, which is the nicotine nasal spray, which is a very good one. And the other 2 are varenicline, which you may know as Chantix, and the other is bupropion, also known as Wellbutrin or Zyban. Varenicline or Chantix, it's extremely effective. It works directly on the nicotine receptors in the brain, so it does a really good job at damping cravings, withdrawals, makes cigarettes not taste so good. You may not even feel like having a cigarette. And bupropion does a good job at reducing cravings, withdrawal symptoms, as well as help with mood sometimes as well. And a big part of this is there's many different ways to go after a quit attempt. And you can use cold turkey, you can use one medication, or you can even combine, which is what evidence suggests nowadays, not just using one medication, but combining multiples to give yourself the best chance.
How long do you stay on the medications?
Well, everyone's different, right? So some people stay on for a week, 2 weeks, and they're done. Typically, if you've been smoking a long time, the longer you're on these medications, the more success you will have. Oftentimes, I will see patients who they're very successful for the first 1 or 2 weeks and they stop the medication and it's too early. Evidence does suggest 3 to 6 months, if not longer, and that increases your success after 1 year.
Now, what about the use of e-cigarettes to replace traditional cigarettes if you're trying to quit? Do you think that helps people?
It can. Some people do have some success with it. There are studies that show it can be as effective as evidence-based medication, but what some people do, they switch from smoking to vaping, and it can definitely reduce exposure and toxins from traditional cigarette smoke. But remember, it's not risk-free. Oftentimes, there's a higher level of nicotine. There could be a much higher level of addiction, which makes it more difficult to come off of those e-cigarettes.
And then part of your patient population that you work with are people that have a cancer diagnosis. Are they recommended to use e-cigarettes if they are trying to quit?
It's not recommended FDA-wise, but we do meet the patients where they're at. There are studies that show that patients who've been smoking 50, 60, 70 years, if that long, and they've tried everything, that vaping may be a viable alternative because of less harm compared to traditional smoking.
Are people physically or psychologically dependent on cigarettes or e-cigs?
They are both physically and psychologically dependent on nicotine, whatever product they're using. It doesn't matter what it is. The physical side effect is nicotine withdrawal, the severe cravings that can happen, which is why quitting cold turkey can be such a challenge. The psychological side refers mainly to routines, the triggers. It is a situation. Is it an emotional trigger? And the attachment that comes with the traditional pairings of the coffee and the cigarette. It's enjoyable. It's instant gratification. Patients have a hard time linking those kind of triggers with the actual smoking itself.
I know some people fear weight gain if
Mhm.
they quit smoking. What do you say to get them through that?
Well, it is a common concern, and most people do not gain a lot of weight, if any. Typically, maybe 3 to 5 pounds, maybe 7, sometimes more, right? But I do remind them that quitting smoking or vaping is one of the best things that you can do for your health. And we can manage that weight at the same time or even afterwards, right? Planning healthy snacks, staying hydrated, and even getting a little more exercise. But it's a dopamine response issue here, right? So it's easy to switch from one smoking or vaping to another one with sweets or high calorie foods. So you want to train your brain to steer away from those things. It's difficult, but it's manageable over time and something you can definitely work on after you quit smoking.
What can friends and family do to help someone who's trying to quit?
The most helpful thing is not to pressure your loved one. It's extremely difficult to quit smoking. It's a chronic relapsing disease. And many of these patients, they fear quitting, the fear they've tried so many times, and they always hear the pressure from their loved one. Ask them what they need. Celebrate small successes. If they've cut back from 20 to 15, that's a big step, right? And don't judge if there's slip-ups or relapses, and help, right? Keeping cigarettes or vapes out of sight. If you live with a smoker, don't smoke around them. Offer distractions during cravings, like going for walks, playing games, talking. It goes a long way. The goal is to be teammate here and not so much a supervisor telling them what to do. It's their journey and they have to figure it out more or less themselves with the support of others.
Well, that's some good advice. I appreciate you making time to talk with us.
It was my pleasure. I appreciate you having me.
My guest has been Jackson Tarr, a respiratory therapist and the tobacco treatment education coordinator for the Upstate Cancer Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.